originally came in with an acute low back injury. His injury was twofold. He had a chronic low back injury that had been around for a long time. He had had a couple steroid injections in the past. He had to be on steroids, oral steroid medications over the entire summer. He felt like that was helping to keep his pain down, but the problem had never really been fixed completely. He was also very sensitive in the back area. So even with a tiny movement, a yoga stretch that he did some weeks ago, it set him in this acute flare, and that's when he came into our office.
Just over a year ago, I herniated my L5 disc, and I was lifting a very heavy granite capstone, like in a fool, and I threw it out. And I went through kind of the conventional medical route, and I ended up with 2 spinal steroid injections on my L5 and then my L4. And then I had the whole summer, last summer, just on very intense steroids, Advil, ibuprofen, and Tylenol. And I have to tell you, the inflammation certainly went down, but the problem wasn't really addressed. I went through the health partner's view of their physical therapy, etc., and was handed rubber bands and everything. And for me, in my case, it just didn't seem to have the address I needed. The back got better, but I went back to that, I would say, a level 4 or 5 pain that I was just stuck with. And then before coming here, I was actually just doing some yoga type moves wrongly, and I ended up compressing my back again, and that's what ended up bringing me in here, as I said on the start.
So another chiropractor had referred him into our office for care, and when he came in, he could barely walk in the office. It was very uncomfortable for him to try to sit in our reception area, and as he came back to the table, we had to help him down onto the table. He was just in a very rough spot.
It's funny because I have a bit of knowledge of chiropractor, and I specifically sought out what Dr. Jen and Dr. J do, which is applied kinesiology and neurokinesiology and neurochiropractic. And for me, that just made sense. I love the concept of that style of chiropractic that just doesn't necessarily solely deal with the structure, but deals with the muscle balancing and the nerve firing.
We found significant weakness in his lower extremities that was contributing to force transfer into his back with even simple daily activities.
I came in an extreme case. I had a very, very intense lower back spasm that I could barely walk into the office. I could barely get to the counter. It was just horrible. And I went through Dr. Jen first, and she was just miraculous for me on my back.
Through our functional neurological assessment and using some of our chiropractic adjustments that were targeted to fix his neurological problem and really get after the cause of his injury, within a few hours after his treatment, he was feeling a great amount of relief. He continued to have that relief over the weekend, and by the time he had come in for Monday's appointment, he was feeling much, much better.
And just within one treatment, and then certainly over the last week and a half here, my pain level is 1 and 2.
We continued to do some treatments for him over the course of that week and the subsequent week, and by the time we had finished 2 weeks of care, not only was he so far out of the acute phase that he was way below, almost to a 0 pain level, which is somewhere he hadn't been in a very long time.
Dr. Jen and Dr. J, for me, have been absolutely miraculous in what they've done. I think they are on the top of their game of what they're doing, their knowledge, and explaining exactly what's been changing on getting rid of my muscle spasms, etc., and get me back into health. So for the first time in, I would say, 15, possibly 18 years, I feel like I could be very close to pain-free, if not pain-free, with a couple of more treatments.
His injury was originally caused by this light stretch that he did, something that would normally cause acute pain in someone, and really it was the weakness from his legs and the firing problem that he was having in his muscles there that was really allowing this small task to develop into a massive injury for him.
All I can say is it's been a great experience for me comparing to what last summer's treatment was on the conventional medical methods. So thumbs up to Dr. Jen and Dr. J. Thank you very much.